Welcome back, guys. In this video we're going to go over the 4 forms that are relevant to a variety of different courses we have developed here at Raindrop Tech, that we have developed here at Raindrop Australia. So the first form that I want to address with you is the release and indemnity form. You're going to give this to your client and it's to be completed once every 12 months. Now there's a grey box on the session log and that's to be completed at every session. And I'm just going to click over to that real quick to show you the grey box on the log that I'm talking about. So see this grey box here. This is a continuation of this form, okay? So on the session log, we have this little grey box that gets completed at every session that says my release and indemnity form continues because nothing has changed, all right? So the release and indemnity, you want your client to put their full name, their street address, and the name of you as the practitioner or student practitioner if it's one of your case studies. You also then want them to circle the technique that applies to them. So if they're having hot stone massage, you would circle that. If they're having raindrop technique, you would circle that. A lot of our practitioners are raindrop technique practitioners as well as VitaFlex technique practitioners, and they're learning hot stone. So in that situation you might circle all 3 because that release and indemnity form then covers you for any particular treatment that you give to your clients. And if you do intend to potentially go down the road of looking at some of our other courses, then have your clients just circle the whole lot. The information then goes in to explain what they're signing, and you can be the witness to this signature. Now, it is ideal if there's a third party that could witness it, someone other than yourself. But as long as your client signs it, or if they're under 18 years of age, as you can see here, it tells you it requires a parent or guardian name and signature to go ahead and work on the child. And if you are working on a child under 18 years of age, then you are required to have that parent or guardian present in the room with you whilst the treatment unfolds. Okay, so the witness signature down the bottom and then the witness's full name, it is acceptable for it to be yours. These forms are not infallible, however they are a great deterrent, and it is important that you have them filled in correctly for each new client and to be completed once every 12 months. All right? All right. So now we're going to go into our client history form. This would be the next thing that you would give to your client to fill out. And it's pretty standard in that, you're going to ask a bunch of health history questions that help us then ascertain whether we A, can proceed, or B, if there's any contraindications that we need to be aware of to ensure the safest experience possible for our clients. So we want to know their age, their name, their address, their email, their date of birth, their occupation, because it often can tell us how much stress they're under. Stress makes the body more acidic. So, the chances of a detox after a massage can be quite high in someone who's stressed. If someone's got a lot of chemicals in their job, such as a farmer or even a hairdresser or sometimes even a nurse or a cleaner, those people, sometimes that occupational hazard, it helps us to identify what needs they have and how we can best support them if they fill in those details. We want the date of the session, and the practitioner's name is your name, okay? So that we're identifying who worked on them from this form. You can't fill this form in for your clients unless they have difficulty reading or writing. You may make a note of that somewhere on the release and indemnity form that you've had to fill it in due to clients' request for assistance with reading and writing, something to that effect. Okay, if it's a child you're working on, the parent must fill in the client history form, but the name on the form is the child and the child's age and the child's date of birth. Okay, All right, so then what we're going to do is we're going to look at this client history form because it's got all these important bits and pieces of information. So first up, we've got important safety questions. Now, there's a list of questions here that apply regardless of whether you're looking at performing raindrop, VitaFlex technique, or hot stone massage. And the first one is, I have a current blood clot, example, ischemic stroke, embolism, thrombosis, or DVT, which is deep vein thrombosis. If your client has any one of those situations, underneath that in bold italics, it tells you what you must do. Raindrop or VitaFlex technique or hot stone must not be performed until written medical clearance has been given. There's no exceptions with that, okay? Now I'm going to flick backwards and forwards between two forms here. So I'm going to show you now where we would take that information and record it on our modification table. Because our client history form is where we collect all the client information, and then the modification table helps us then to record that so that we know what modifications we're making and what factors of safety and contraindication we are taking into effect for each individual. So at the top you'll see here modification table for whatever the recipient's name was. First thing it says, blood clots. If they had ticked yes that they had a blood clot, it tells you in bold italics what's going to happen, and on the modification table it tells you the same thing. So if they'd said yes, do not proceed with session until cleared of blood clots. A new client history form should be completed at that time. And you'd put a line through this form and you would write down here additional details, waiting for medical clearance before proceeding with treatment, or waiting for medical clearance regarding blood clots before proceeding with treatment. Okay, so that's where we would take that information and translate it across. Next, in the important safety questions, we've got things like, I am on pharmaceutical or herbal medication for thinning the blood. I have high blood pressure or HBP, or I'm on medication to control high blood pressure. We ask that question because people who actually are on medication to control high blood pressure will tell you that they don't have high blood pressure because effectively the medication controls it. But they still have to, they still have medication they're taking because they had high blood pressure. So we still want to look at what contraindications are relevant for someone who is in a situation where they're either medicated to control their high blood pressure or they currently are experiencing high blood pressure. We want to know if they have a bleeding disorder, because if they have a bleeding disorder, then we're not going to perform hot stone on them. We want to know if they're pregnant, less than 15 weeks. We're not going to perform hot stone if a person's pregnant, whether they're less than 15 or more than 15 weeks pregnant. And this is due to the heating up of the body and the body's natural body temperature. Pregnant women sometimes hold anywhere between 5 and 8 degrees more for their body temperature than the average person, and hot stones are going to raise that up. So just to err on the side of caution, we want your insurance to always cover you and keep you in a safe realm as well as your clients. And so we would encourage you not to perform hot stone when someone is suspected to be pregnant or is actually pregnant. We then ask questions of, I have had an epileptic seizure, I am under 5 years of age, I am under 18 months. Okay, so there's all this little grouping here then of other important safety questions that we need to ask when we're working on a person for the first time. So our bold italics then tell us what we need to do. So we want to refer to our safety data for avoid and caution oils for any of these questions. We want to look at HB or medication for. If someone has ticked that here, then we're going to omit the lymphatic foot pump and the finger pull. When we are looking at pregnancy, someone has ticked pregnancy, we would look at a pregnancy release form, and we would also look at refer age other in modification table. If 18 plus weeks, place pillow under right hip and shoulder when on the back. So there's some modifications there because we can perform raindrop or Vitaflex on a pregnant person. So there are situations where this form is, you're okay to continue on. Now let's look at I am breastfeeding, because we have some specific bold italics here giving us further indication of modifications we may need to make. Certain essential oils may increase or decrease milk production and may be tasted in the milk. Refer to the safety data guide and modification table top left and age other. So age other has been referred to twice, and so has the safety data. So let's go over now to our modification table and let's have a look at where we would record that information. Here's our important safety questions, and it's been boxed for you. So the same thing here is being asked. Has they ticked an epileptic seizure? And then the bold italics underneath will tell you what you're looking for in the safety data guide pages. So remembering that your safety data guide is that hard copy book you were sent, or you may have already printed the digital copy if you're keen to get started. And it's going to have all of the codes in there and what oils pertain to what particular contraindications and ailments to look for. So if someone had epileptic seizure, you would avoid all E+ codes. If someone had high blood pressure, you would avoid all HBP+ oils, and then you would use with caution HPP oils. Or if someone was on blood thinning medication, you would avoid all A+ oils and caution with A oils. Now, if we come over to the right hand side here, these two columns are there for you to list oils in particular, and we even have the allergic to nuts question in there. Okay, I'll go into that in just a second. But when you're looking at making signature blends for people, it's really important that you don't use a contraindicated oil. Obviously, you can't put it on them. So we want you to get into the habit when you're using this form and someone has highlighted one of these important safety questions, we want you to go through the safety data guide, look at the codes and write down the oils to avoid in any particular situation that they've ticked off. And if it's a caution oil, then write those in this column here where it says oils to use with caution, small amounts or diluted. Now let's talk about what's a small amount, or when I'm using an oil with caution. What we mean when we say that is small amounts typically is 2 drops maximum in the entire session. So if you were going to add an oil that had to be used in caution for someone with high blood pressure, and you just wanted to add it to their carrier oil today because you just felt that it would support them in other areas of their life, then you would only use 2 drops absolute maximum in the volume of base oil that you're going to be applying to the body. All right. The other thing that you can do in raindrop technique and also in Vitaflex technique is you can dilute the oils into a 5 ml bottle where you would put 1 drop of essential oil to 4 drops of, say, V6 or carrier oil, depending on what their nut allergy situation was like. All right. So I just want to come back. I hope that's nice and clear there about where we're putting our information of our important safety questions. Now, our important safety questions haven't quite finished. It's a whole column. So we're going to go down a bit further. We're still on the left side here. And it says, I have a nut, seed or vegetable oil allergy. Oils I am safe to use topically. And we've got rosehip, olive, sesame, almond, safflower, sunflower, young living V6, coconut and hemp. And the bold italics tell you what to do here if someone has ticked it. Refer to Safety Data Guide, that's what SDG stands for. Only blends with no carrier oil or containing one of your safe carrier oils will be used. It's very important to highlight to you here that these, when your client ticks these, they're ticking that they are safe to use them topically. All right. Now coming back to the modification table, here is our question: allergic to nuts. You would tick that there because you, as the practitioner, are filling in, or the massage therapist, are filling in this modification table for this client based on the information they've given you on the client history form. So you would tick allergic to nuts. You would check the blends in the safety data guide. So you might have perhaps thought someone's allergic to almond oil. They've let you know it's not a safe oil for them to use, and you think, oh, I'd love to use Ortho-Ease on this person, but it has almond oil in it. An oil to avoid them would be Ortho-Ease. You would want to avoid that proprietary blend, and you would put it over here in the oils to avoid. And the safety data guide gives you the massage oil ingredients at the very back of the safety data guide as well. All right, coming back over to the client history form, we have one more important safety question to ask before we get into operations and medication. Now, it says here on this left-hand side, I have had a past reaction to chemicals, pharmaceuticals, herbs, or essential oils, and have not safely used this same oil in the Young Living brand since the reactions. We want to know, why do we want to know this? That's the first question you're going to ask. Someone's allergic to, well, I'll use myself as the example. I'm allergic to the pharmaceutical drug of penicillin. Now, my body goes into, it was very young when I had it, and my body went into a massive rash all over it, red and itchy. And so I don't know what constituents are in that particular drug. And essential oils are made up of hundreds of different constituents. So if I'm going to be creating signature blends, or I'm doing raindrop technique or VitaFlex technique, if my client has ticked this, I need to really recognize that any aromatherapy oils that we introduce need to be done so slowly. So if you have a look at the details, we want to know the details. So in my case, it would be penicillin, severe rash. Okay? So in that situation, we would look at doing a level 2. A level 3 would have been if I'd gone into an anaphylactic reaction, or I required hospitalization and it was life-threatening. That's when we would look at doing a level 3. Now, let's talk more about the levels in a little bit, but what level 2 and level 3 is basically highlighting to us is we're going to pull back a little bit on the amount of massage blend oil or potentially essential oil that we're going to use to ensure that it's introduced to the body slowly, okay? And that's for toxicity. I was quite sensitive to the penicillin, and so it's had a toxicity reaction in my body. Now, if the reaction was to essential oils, you also avoid those essential oils and any blends containing that. And so you could either refer to the current desk reference, which is what CDR stands for, which is the Young Living, not Young Living, which is the Life Science Publishing desk reference, or you can have a look at the safety data guide because it contains all the blends ingredients in there as well. So where are we going to take this information? The bold italics is telling me I've got to do something, a level 2 or 3 modification for toxicity. If I come straight over to the modification table, I want to be looking for the word toxicity. It's telling me to do something here. And here is the word toxicity. So straight away, that client history form, that question, if it's been ticked and I'm getting the details, I'm going to be looking at ticking level 2. All right? Which would happen just here where the number level 2 is. All right. So, coming back to our client history form, we're going to finish the left-hand side of the column here. Now, operations and medication. We'd just like to know all the operations and procedures that have involved general anaesthetic, because general anaesthetic is quite a toxic thing to put in the body. And so it can mean that a person can have quite a big detox or release when they've received a hot stone treatment or a raindrop technique or a VitaFlex technique. And so we're likely to gauge a better understanding of how big a release or how big a detox they're going to have based on understanding how many operations they've had in their lifetime. Now, people, I'm happy for you to write on a secondary piece of paper if people have lots of information, remembering they're only going to fill in this client history form once every 12 months. So we want to capture as much detail as we possibly can in this snapshot here. The same with the current pharmaceutical medications. We want to encourage that if they're taking blood thinners and they're receiving regular treatment like hot stone or raindrop or VitaFlex, they request regular monitoring from their doctor and adjustment to their medication levels if required, because these beautiful natural alternative therapies have been known to help the body self-heal. And so in that process, we need to make sure that their GP's authority is respected and say, hey, can you check in with your GP and just see where your levels are at, just to make sure there's no adjustments required. Because if people don't need to be taking medication because the body's helped itself, then that's fantastic. All right? All right. Now, I know this is big chunks of information to take in. So our operations and our medication is just information that helps us to determine what's gone on previously in the history of the client's health regime and, their story. All right. Now, coming to specific conditions. This is our middle column. Now, again, there's this common theme where the bold italics are telling you what to do. All right? Specific conditions. In the past 12 months, I've had bone cancer or a spinal fracture or severe osteo. Details. Someone may even put there a spinal operation. That's going to ensure that we modify with these bold italics here at the bottom. Okay? That's what we're going to modify for these two specific conditions here. The other one is I have a herniated, slipped or bulged disc or a spinal injury, and I'm experiencing one or more of these symptoms. So if they're experiencing pain that wakes them at night, pain which can't be relieved, numbness, tingling, weakness or pins and needles down their arms or legs, a change in bladder or bowel function corresponding to the onset of the disc issue, that unless we're given medical clearance, we are going to omit VitaFlex thumb rolls, the finger straddle, the finger pull, all hot stones, and all other back moves would be performed gently. So some of you who would be going, what's VitaFlex thumb rolls, what's the finger straddle, what's the finger pull? They are moves very specific to raindrop technique as well as components of the VitaFlex technique. All right, so here's some more information. We need to translate it onto our modification table. How do I do that? Let's go over to the modification table. And you can see now we're in the middle of the form. And it's got specific conditions. And then it's got the modification or additional oils required as a result. Okay? So in this situation, if someone said, I've had bone cancer, they've ticked that, the details is bone cancer. We are going to write over here on the modification table, bone cancer. And then right next to it, we're going to write word for word exactly what is highlighted here. Unless medical clearance, omit VitaFlex thumb rolls, finger straddle, finger pull, hot stones, and all other back moves performed gently. Irrespective of what technique you are offering, if it's hot stone that you're planning to offer, and then suddenly you find out this person's had bone cancer, you could still offer the beautiful sequences that you will learn of effleurage and petrissage and, different maneuverability for a relaxation massage. You just would not be able to offer hot stones. And all back moves that you would do, you would perform very gently. but you're going to copy and paste literally all of those words into the modification table next to where you've written their specific condition. Okay? All right, let's keep moving along. So again, these are still specific conditions. I have current back, neck or sciatic pain. I have current or past physical injury. I want to see the details of what that injury is. If someone's had a knee injury, right knee injury. If they have a herniated, slipped or bulge disc, that's current, or if they have scoliosis and or rods in their spine. Just some brief details about what that is so that I know that you're identifying what your client's needs are. It forms part of your assessment to have your paperwork filled out diligently and correctly. Now, in this situation, we have a new section here which has another lot of bold italics that then give us a different modification based on these specific conditions. So if someone ticks one of these boxes, again, we just want some brief details, and then we are going to take that information and copy and paste exercise caution when working around this area, checking to ensure no discomfort. If the person has scoliosis, you will then add the modification for scoliosis as well. Let's have a look at the modification table and where I'm going to write that information. So it's still the middle column of the client history form under specific conditions. So we would put that information here. Let's say they had scoliosis. We would write scoliosis here under specific conditions, and then the modification would read, exercise caution when working in this area, checking to ensure no discomfort. Scoliosis, work up or down the spine, according to which gives best results. See that there? So we want that word for word, and then you don't have to write up or down the spine. Make the decision. Scoliosis, working up the spine to see for the results. Could be written down here in additional details. All right? So make the decision, but obviously we want the modification to be written word for word. It's part of ensuring that the safety protocols of these forms are followed to the letter, which ensures that your insurance will keep you covered at all times. All right, we're down to a new section now. Still in specific conditions, I have multiple sclerosis, I'm a quadriplegic, paraplegic, or I have back pain or nerve issues that affect my mobility. Just some details here, and then we've got the highlighted what we're going to write, raindrop technique to be performed down the spine. So in this situation, we're talking about hot stone. It makes no difference to us because we're not doing raindrop technique on the person. However, you would still write their back pain over in the modification table here. And then you might just say, check in with client on around pressure when working the area, or something to that effect. But if it was raindrop that you would perform, you would specifically write raindrop technique will be performed down the spine, because that is what the copy-paste modification requests of you from those bold italics. All right, still coming further down now under specific conditions, we have things to do with the heart. I have arterial sclerosis and arteriosclerosis. I have cancer or acute inflammation from bacteria, viruses, poisons and allergens. I have current or past heart disease, including cardiomyopathy, congestive heart failure or a heart attack. In these situations, we'd like to know what it is, and then for raindrop technique and VitaFlex, you would omit the finger pull. And in hot stone, you would actually omit hot stone altogether, okay? We do not want, when someone has had heart disease, we do not want to be creating any increase or pressure of blood flow through the heart, because it may place unnecessary pressure on the heart that we don't need. So in that situation, we could still perform raindrop technique, we could still perform VitaFlex technique. There is just a specific move called the finger pull that would be omitted. And we could also do a relaxation massage without the hot stones, using the same sequence we would normally, just without the stones. And then again, that contraindication or that modification would be written over here, still under specific conditions, and then, omit the finger pull, and hot stones would be written there as well. Now, I want to see you write the whole modification, irrespective of whether it's for hot stone or for raindrop or for VitaFlex. It's just a good practice for you to be in. Many of our students go on to become well versed in all the different modalities that Raindrop Australia offers as a College of Natural Therapies. And so it's just good practice, because effectively one day your client may rock in to see you wanting a different treatment, and you've already got the reminder there on their modification table on what you're required to do given their specific client health needs. Okay, now I have a skin rash, lesions, stitches, or I have synthetic or metal parts in my body, like pins, pacemaker, breast or metal other implants, contraceptive implants, IUDs, and internal mesh. We just want the details there of what it is. In some situations it might be breast plants, it could be a pacemaker. Our modification, if that is the case, is we would write what it is. So coming over to our modification table, we would write skin rash, and then the modification would be essential oils will not be applied directly over the top. And you can see here, essential oils will not be applied directly over the top is the modification. So this bold italic information is always guiding you. And then when we get to our modification table, there's a little bit of further guidance to go with there. All right. Now, we are finishing off in our specific conditions here, and we're looking at our mental and emotional state. The first box is I am highly stressed, emotional, or anxious. I have depression or take antidepressants. I have a diagnosed mental health condition. If any of the three boxes are ticked, a level 1 or 2 modification for emotions will be chosen for the first session. All right, let's talk about these. If I have a diagnosed mental health condition, it can't be self-diagnosed, must be diagnosed by a doctor. And what we're talking about there is details like perhaps the person has autism, perhaps the person has schizophrenia, multiple personality disorder, bipolar, PTSD, ODD, which is oppositional defiance disorder, or OCD, or, there's a variety. They will know. They will know if they've got a diagnosed mental health condition. Now, I know that depression is a diagnosable mental health condition, and so is anxiety. However, in this instance, if they've been diagnosed with a mental health condition of depression, then just saying I have depression or I take antidepressants is sufficient. If they tick 2 boxes there, that's okay, but we must have the details of what it is. So if they've ticked I have depression or take antidepressants, and then they tick I have a diagnosed mental health condition, the details are depression, then we would consider a level 1 for that person. However, if they say I'm highly stressed and emotional or anxious, I have depression and I take antidepressants, and I have a diagnosed mental health condition such as bipolar, then we would consider looking at a level 2 modification for the emotions. And the reason being is this: a mental health condition, again, places the body into a highly stressed flight response state, and that produces a huge amount of acid in the body. And so when that happens, we want to gently introduce, we want to pull back a little bit how much oil we use on them, especially if we're using essential oils or massage blend oils. We just want to pull back so that we introduce it slowly to the body, minimizing any effects of a major detox or release. Now, there's somewhere special to record this, and it tells you on the bottom in the bold italics here. It says a level 1 or 2 modification for emotions will be chosen for the first session. So let's go over to the modification table now. And it's telling you here, because we've finished specific conditions, okay, that was the middle section of our form. Now we're coming down to the bottom section of our modification table. And here we have emotions right in the middle there. Now, for the first session, choose a modification level. 1, if they're highly stressed, anxious, or a level 2 if they're diagnosed mental health condition other than depression or anxiety. So again, we have these beautiful little italics that tell us what to do, reinforcing what the client history form told us. Okay, so in this situation, we said that they were highly stressed and also on antidepressants and also had bipolar. So in that situation, we would tick a level 2. Okay, and I will go into our levels and sessions over here in just a minute. But what we're saying is we are pulling back. We are using 2/3 less than what we would normally use on our client to ensure that they have a beautiful and uplifting experience. All right. So that fixes the middle column. Now, hang in there with me. I know it's been 36 minutes and it's a long video, but it's such important information and I really need to make sure that you understand it and that I'm clear and concise in all that I'm telling you. And if you do have any questions, please don't hesitate to email us because I'm more than happy to correct myself and redo this video as many times as we need to ensure that everybody's getting the correct information. All right, so the last column, the right-hand side, chemical exposure. There's a bunch of questions here. I am a universal reactor with extreme sensitivities, environmental and or chemical sensitivities. And the next question is, I've had significant chemical exposure from my environment, amalgam fillings, hobbies, profession and or recreational drug use. The details can be something as simple as you know, I'm a nurse, I'm a hairdresser, I'm dependent on pain medication and have been for 10 years. I wouldn't call that recreational drug use, but I would still call that drug use, especially because a lot of people are on opiates for their pain in this day and age. So if somebody ticks either of those 2 boxes, you're going to choose a level 3 modification for toxicity. What we're saying is we're going to dilute it down as much as we possibly can to introduce it to the body as slowly as we can. All right? So in that instance, if one of those 2 were ticked, you would go straight to the modification table and you would look at toxicity here. And you would say, we're going to go through to a level 3 straight away. All right? All right. Let's keep going with our chemical exposure column. So these questions then are helping us to identify what's the level of toxicity in a person. How likelihood is there, what's the likelihood of them having a big release? So the next questions are, I am a smoker. I average so many cigarettes a day. You can get them to fill in how many. I drink more than 4 glasses of alcohol per week. If so, how many? I drink fewer than 8 glasses or 2 litres of plain water a day. Again, we need to know how many because that's going to help flush. If they're hydrated and they're going to have a release symptoms or some sort of detox, then, hydration is the key for them to get it out of their body as fast as possible. And then also, I don't have bowel movements every day. If so, how many times per week? Because obviously we want their body to be working more efficiently and more effectively. And beautiful thing about hot stone is, and relaxation is, it frees up some of that tense and stress and anxiety that prevents people from having regular bowel movements every day. Now, it's also part of the chemical exposure, but what we're asking about is in the last 12 months. Because in the last 12 months, if any of these things have been experienced by the client, then that's going to have a fairly heavy impact on the modification table and how we then gauge what kind of session we're going to give them. So it covers things like autoimmune disease, high blood pressure. If they've ticked that, you want to make sure that your that your modification table has that extra information. Okay, you want to make sure that it's been checked off over here because sometimes people miss it, but they might have been diagnosed in the last 12 months. Do they have Parkinson's, MS, arthritis, diabetes, stroke, cancer, HIV/AIDS, hepatitis, emphysema, asthma, cystitis, migraines, candida, thrush, allergies, herpes, cold sores, Ross River fever, glandular fever, fibromyalgia, Lyme disease, chronic fatigue, heart disease. All of these bold illnesses here can make a difference. And then we go on to looking at dermatitis, eczema, psoriasis, rosacea and acne, IBS, colitis, diverticulitis, leaky gut. You've had amalgams removed from your teeth, had a general or local anaesthetic. If they've ticked that, we want to see over here under operations and medication that they've actually listed it there. Been on antibiotics or been vaccinated, taken synthetic hormones, or been on pharmaceutical meds other than antibiotics and vaccinations. And then there's a little spot down there as well, just to write other infections they may have had in the past 12 months. The reason that we put that there is things like laryngitis or, even tonsillitis. But there are situations where people have had other things going on with their health in the last 12 months that we haven't taken into account. So we want to give them an opportunity to voice that so that we can take it into account. All right, so pausing now at health regime, what we're factoring in is on the right-hand side from this bottom point here all the way up to here. If anything is highlighted and ticked here, except for chemical, if we're going straight to level 3 because they're a universal reactor or they've had really significant chemical exposure. But generally speaking, if 3 or more are ticked in this highlighted section, you're going to modify. Now let's go over to the modification table. What we're going to do is we're going to count up the ticks in that highlighted section. Okay? Remembering that we pause at the health regime. We're going to come over to the modification table and we're coming down to our chemical exposure column. Can you see it's got the same title, chemical exposure? It's asking you the number of boxes ticked in the chemical exposure section. Now, let's say this person had 3 boxes ticked and arthritis was one of them. Let's come back over here for a second. Let's say that arthritis was 1. So that's a bold illness. Can you see it's darker than these other ones that are listed down below? And, she drinks, let's say Amanda Jones, that's the name that I like to use. Let's say that Amanda drinks fewer than 8 glasses or 2 litres of plain water a day and that she doesn't have bowel movements every day. She may only have sort of 3 to 5 a week. All right, now that's quite common for a lot of people. Over here, she's still only got, so they're her 3 ticks. She's got arthritis and those 2 ticks, and nothing else was really stood out for her. We're going to put number of boxes ticked in the chemical exposure section. We're going to write the number 3 there because that's how many ticks we counted up. It also says here, don't count the health regime boxes, just to remind you. And it then says, are there 3 or more boxes ticked? Or is there less than 3, so this is the less than sign, but severe and recent? Now, we could say Y for yes. Yes, there is 3 boxes ticked. If you answered yes in the above box, you must modify unless the health regime counterbalances that. I'll talk about the health regime in a second. Let's go over to where we're going to modify this information, because chemical exposure, remember, relates directly to toxicity, okay? The emotions relates to the emotions, and age other is something we'll cover in just a minute. So coming up to toxicity, it says here, for the first session, choose the modification level. So for the first session, choose the modification level, nil. If 0 to 2 boxes are ticked, none are severe or recent, or nil if 3 to 6 boxes are ticked, but they're counterbalanced by the health regime. Okay, well, she had 3 boxes, so nil doesn't apply. You must modify the first session. So then we're going to choose from this, 1, 2, or 3. If no bold illnesses are ticked, or there's a current detox program, we'd do a level 1. But remember, I pointed out to you before that arthritis is a bold illness. So if a bold illness is ticked, but the condition's not extreme, then we do a level 2. So in this situation, Amanda Jones, having those 3 ticks marked, she would then be a level 2 because arthritis was a bold illness. Now let's say she only had 2 boxes ticked. Let's say it was that she didn't drink 2 litres of water a day and arthritis was really playing up for her. Then we could actually say, you know what, we're going to do a level 3 on you because right now your symptoms and your illness of arthritis is really prevalent in your life and it's disrupting you. Okay, so we can then do a level 3. And then also we have a number 2 or 3 level for severe reaction to chemicals, drugs, herbs and essential oils. Now remember that was part of our safety questions. All right, so then we're making this decision that she's a level 2 here. Okay, now Amanda Jones is just an example, but the point I'm trying to make is this. From these information, we will then draw a conclusion in just a moment. But before we make our final decision, we need to factor in any health regime a person might be considering. So let's have a look at the client history form to see what that health regime might look like. So for the health regime, in the past 3 months, I have been on a 10+ day liquid only detox regime, consumed Young Living oils or supplements daily, or received a full raindrop technique. For any of the modalities, whether it be hot stone massage, raindrop technique or VitaFlex technique, if your client ticks one of these 3 things, we need further details about it. Now your client might say, oh, you know, but I've been taking these other supplements, they're not Young Living, and I've been on it for 3 months. That's fantastic. Please do not discount their willingness to support themselves and to take steps towards creating their own wellness plan for themselves. But for our countermeasure purposes, only these 3 situations can be considered for the health regime to counterbalance someone's chemical exposure column. So what does that mean? Been on a 10-day liquid-only detox regime. That's something like the Master Cleanse or a juice fast or a water fast. Consumed Young Living oils or supplements daily. In this situation, we want to know how many drops of oil they're taking or what supplements they are taking. And if they've received a full raindrop technique, the reason, and it has to be in the last 3 months, and the reason that we say that is raindrop technique uses up to 140 drops of oil on a person. So there's a beautiful cleansing process that occurs with that particular technique from the VitaFlex components that make it up. But if someone ticks that, we need you as the hot stone massage therapist to ring the raindrop practitioner and verify that that was a nil modification so that they had received the full amount of drops for the raindrop technique. So coming back over to the modification table, let's look at including our health regime questions now. So back under chemical exposure, it now says, is there any health regime boxes ticked? Well, we're going to say yes. We're going to say that Amanda Jones had a full raindrop technique with me a month ago, and you've been able to call me and verify that it was with me. So you're going to tick yes, there's a health regime ticked, and then you're going to record the details and if possible the number of essential oil drops. So here you would write verified raindrop technique with Nat Man, 140 drops of oil or of EO used in the session. Now, in that situation, we want to know, is it in depth enough to counterbalance? Well, let's have a look here at the bold italics down the bottom, because it gives us a bit more guidance about the counterbalance. If a recipient had an intense 10-day liquid detox program with no solid food in that time, or consume 10 drops a day of Young Living oil for 2+ weeks, or received a full raindrop technique with no detox afterwards and no major chemical exposure since, then the good things that this person has done counterbalances 6 ticks in the chemical exposure column. If greater than 6 ticks, you're going to modify for toxicity as per normal. Right, so let's go back to Amanda Jones. We said she had 3 ticks listed here in this box, but we've been able to verify that she's had a full raindrop technique, so that is in-depth enough to counterbalance. So what we're saying is that raindrop technique wipes away 6 of these chemical exposure ticks. Well, she only had 3, so that makes it nil now. So then when we come over to toxicity, we can see here nil is going to apply. So she's got nil if 3 to 6 boxes were ticked, but counterbalanced by the health regime. So I hope that's clear to you guys. She did have 3 boxes ticked. She's got a wonderful health regime in place that's one of those 3 things that we've highlighted. It counterbalances, which then means that her 3 to 6 comes back to a nil for toxicity. Now let's assume for a moment that Amanda had 7 here, or even 8. And let's say she'd done the master cleanse and had a full raindrop. This doesn't give you double the numbers, okay? 8 ticks in a chemical exposure column, regardless of how many of the health regime aspects they have done, will only ever counterbalance for 6 ticks. Now, even with saying that she had a full raindrop, and yes, it's in depth enough to counterbalance, we still would have 2 ticks potentially left over. So it's actually not enough to counterbalance because she has more ticks than the number 6. So in this situation, despite the wonderful thing that she had done by going on the 10-day detox master cleanse and having a full raindrop, it's not enough to counterbalance her original numbers that we first counted up in that chemical exposure column. So we would then still modify for the number being 8, and in this situation it would be dependent on whether she had bold illnesses or not as to whether you would choose a level 1 or a level 2. All right, now almost there guys, almost there. Age other, let's touch on this because age other is relevant to our safety questions up here. So if someone's pregnant, if they're a child, or if they're breastfeeding, there are situations where your age and those other circumstances, such as breastfeeding and pregnancy, are going to play a part. Now, for you to be sure, because we don't ever want any of these boxes not marked, we want to see that you are working out all of the modifications necessary based on what your client's history says. So for age other, your first session, you're going to choose a modification level of 1 if the person is aged 5 to 16 years, and you can ramp up if they have no major detox effects after that to a nil. You're going to do a number 2 if they're aged 18 months to 5 years, and you are not going to ramp up until they are older than 5 years of age. Or if they're aged 70 years or over, you're going to do a number 2 level on them. But you can ramp up if they've had no major detox afterwards. The reason that we consider this for our older clients is because they've had years to accumulate. Okay, so looking back at the age other again now, for if a person was 18 months of age, we wouldn't ramp up in those situations. And we'd look at doing a level 3. And then for pregnancy and breastfeeding, you're going to choose a level 2 if they're breastfeeding, or 15 weeks pregnant can ramp up. Other than if, we're talking hot stone, you've already been advised that you're going to not perform hot stone on anyone who's pregnant. in both of those situations there. All right, now coming over to conclusions. I know it's been a long video, guys. Hang with me. We've got 2 minutes left. Out of these 3 boxes here, we want to choose the most conservative number, okay? So we want to choose the highest number. So, you know, we talked about she might have had a nil for toxicity. We were talking about a level 2 because she had bipolar. And then, you know, none of these things applied to her. She wasn't pregnant. She wasn't breastfeeding. So we said nil there. So our highest number, excuse me. So our highest number is going to be the 2 for emotions. So that's going to mean that we're going to use a really conservative level on this person. So over here where it says for their first session, we're going to select 2. Now let's look at what the breakdown of those levels are. The modification levels, nil equals a full session, meaning in Raindrop, no dilution of oils is required. And nil also means in hot stone massage blends that you would dilute the massage blends 1 to 4 and you don't ramp up from there. A level 1 means in Raindrop you're going to reduce the number of drops on the back and the feet by 1/3, also the same with Vitaflex. A level 2 means that you're going to reduce the number of drops on the back and the feet by 2/3 for Raindrop and Vitaflex. However, level 1 and 2 still, when it comes to hot stone massage blends, would be diluted at 1 to 4. So whether you are using the Young Living massage blends, proprietary blends that we talked about, that's what we're talking about when I'm saying to you that you want to dilute those 1 part massage proprietary blend to 4 parts a base oil like hemp oil or jojoba oil or whatever a safe carrier oil is for your client. Okay, now if a person works out to be a level 3, we're going to dilute all oils 1 drop essential oil to 4 drops either V6 or veggie oil in the situation of Raindrop or Vitaflex technique. But with hot stone massage, if a person comes out at a level 3, we're actually going to dilute the oils 1 part massage proprietary blend to 8 parts carrier oil or base oil. And we're not going to ramp up from that. The massage proprietary blends that Young Living create work so beautifully on the body that we want to support with the hot stone massage a beautiful gentle integration of those oils being carried through the blood and through the body as the body relaxes and lets go to the hot stone massage. In a very rare occasion, we'll see someone who's a level 4 where you just don't feel comfortable putting essential oils on them at all. And in that situation, you would apply all the oils in the aura. However, if it was a situation with hot stone and they were coming out at a level 4, you may choose to not do hot stone on them. You may choose only to use a base carrier vegetable oil that is safe for them to use. And you may just choose to just do the relaxation component without the stones until you feel that their health is in a better place, that they could be moved from a level 4 to a level 3. Now, how do we know when we can move up a level? Well, over here, you've been told there are a couple of situations where you do not ramp up, and that is if a child is aged under 18 months or under 5 years. 5 years and under, you do not ramp up. And if a person is less than 15 weeks pregnant, you do not ramp up. In the case of hot stone, if anyone's pregnant, you are not performing hot stone on them at all. If there are no release symptoms from the first session of Raindrop technique or Vitaflex technique, and their age and pregnancy issues are not highlighted, then it's okay to ramp up 1 level for each future session. So if they come to you and they start at a level 3 and they've had no major release symptoms from their first session, then the next session you might try a level 2. And then the session after that you might try a level 1. And you'll gradually build until you get to a nil modification. In Hot Stone, if they come out at a level 3, they are always going to have their massage oil blends diluted 1 to 8. And if they come out nil, level 1 or level 2, then in Hot Stone massage, their massage blends will always be diluted 1 to 4. Any further additional details can be recorded here. And also, we want to skin test any of the oils that we plan to use on our clients. Raindrop has specific protocols for this, as does VitaFlex, and the plaque test is relevant to those techniques as well. The plaque test is something that you will see a demonstration video of, and if it is not satisfactory, you will actually not do Hot Stone massage and you will omit finger pull and auricular ear VitaFlex technique. If the plaque test result is not satisfactory, I would highlight this so that it draws your attention on your modification table. From that, we then have successfully completed that modification table, and we have taken all the information from the client history form and recorded it where we as the therapist need to know and at a glance what recommendations we've created for this tailored session with the client. The last thing that we have is the session log. So as we talked about before, this little grey box needs to be signed every session. It's the continuation of their original release and indemnity form. Body assessments will apply depending on what session you're doing. Now, shoulder height, pelvic tilt, ankle length and pelvic rotation are all part of Raindrop and VitaFlex assessments. However, if a person had injury and you were doing Hot Stone or scar tissue, you may choose to mark certain areas of the body to remind you that that is where there's going to need to be some caution. You're going to remind yourself on the session log what the modification you've chose to use is. And then you're going to make some notes about what you observed during the session. You can add additional oils here and why you've used them. Increase in height is relevant to VitaFlex and Raindrop technique. Here we have a section for your recipient to describe to you how they felt or any realizations they had during the session. And then reminders that you need for yourself next session with that client. There's also a spot for you to write useful oils for the recipient when it comes to essential oils, and a date for your follow-up call so that we can ensure that aftercare is being maintained with your client. There's also a place there to write the comments from the phone call. A text message is satisfactory as well. And then effectively you would ask them if they're interested in having more sessions. And I would even encourage you, when you ask that question, to word it of, are you interested in having a tailor-made client wellness program? And if yes is the answer, when are they available to sit down and do that with you? All right. So if you're doing a second session, you do not need to fill in those first 3 forms that we showed you. The second session, it would just be this session log that you fill in with all of the details of the recipient name, what session number we're up to, the date of the session, and then you would continue to make notes around what you observed and what the client experienced and felt during that session. These forms, again, I will remind you, are relevant for Raindrop technique, Hot Stone massage, as well as VitaFlex technique. The only difference is the Chakra Sutra and the Ultimate Balance will have a different client history form, but the modification table, release and indemnity, and the session log is still the same. All right, guys, thank you so much for your patience and perseverance. I know that's a lot for you to take in. We have sent out to you master copies of this to have a look at. I've given you an assignment where you can practice the information that you've just learned, and I just want you to take your time with it. Please email me, ask me any questions. If we need to have a phone session where I can coach you through some safety information, I'm happy to do that as well. Once again, thanks for listening, and I'll see you guys in the next video.